Recovery is stupendous.
Achievable.
Hope.
Freedom.
Freedom.
Empowering. It's unique to everyone.
The journey, not a destination.
Getting a new lease on life.
Finding restoration after you fall down.
Recovery is having the freedom to enjoy life.
For me, it was finding a way to really love myself.
My recovery is possible in part because of my own sense of purpose.
Welcome to Montana's Peer Network podcast. We're doing something a little bit different today. We've got Facebook Live. We want to welcome those viewers who might be just tuning in. We're going to give you a little tidbit, a little taste, a little appetizer of a podcast. So we thought we would record the first portion. And so here we go. We've never done this before. So I'm Jim Haney, Executive Director of Montana's Peer Network, and I have from Missoula on the phone,
Katie Sorensen.
All right, Katie. You might have to speak up just a little bit there. That was a little quiet. Usually you're a little louder than that. So.
Nobody's ever said that to me before.
Well, that was a little bit quiet. Maybe I need to turn my headphones up a little bit. Maybe that's what it is. So, okay. So again, Facebook Live, welcome. You're wondering what in the hell are the Peer Network doing? So we're doing a podcast, and we're going to put it on Facebook here. But you're not going to get to see the whole thing. We're not going to record the entire podcast on here. You're going to have to go to SoundCloud, and you're going to have to catch the rest of Katie and myself. So, well, we have a lot of topics to cover today, don't we, Katie?
Yeah. Certification. Montana got an F in treatment of mental illness on the Grading the States rubric.
Yeah, oops. Yeah, we're going to talk about that. Yeah. Yeah. Today is World Mental Health Day, October 10th. So we want to touch on that, right? And then we also want to talk about this national peer certification. I know we sent something out to members a couple of weeks ago, and so I think we want to talk a little bit about that, don't we?
Yeah, and if you want to make that happen so you can be pretty plugged into what's going on here, that's coming up, and there's the deadline is November 11th.
Yeah, well, yeah, so if you're a peer supporter, you definitely want to get certified, but Katie's right. I mean, if you're tuning in, you're not a member of Montana's Peer Network, you definitely want to sign up. It's free for a general membership. And so, gosh, we've got about 935 or 36 members across the state. We'd love to have you. If you're out there listening and you're not a member, this is how you're going to get the information about trainings and podcasts and webinars and all the different events. And yeah, exactly. And, as a member, you get in free to the annual conference, and we just had that last month, and so as a member that's one of your benefits. You don't pay admission. So all right, so I don't know where you wanted to jump in. We threw a bunch of stuff out there. Being October 10th, do we want to talk a little bit about World Mental Health Day today?
Yeah, you start.
Sure. So, World Health Organization, if you're not familiar with those guys, WHO.int, World Health Organization, they put out a lot of good, just general health information, not always specific to mental health, but I got their page pulled up here for today, and talks a lot about young people, mental health, and the changing world. There's all kind of fact sheets There's a handout. Young people in their 20s experiencing depression. There's a video. You might know the video series, Let's Talk About It. That's been around for a while. That was targeted at parents. How do you talk to your kids about mental health? So they got videos on here, health risks, and then how do you outreach to kids? There's suicide prevention, and then different events that are going on. It says here half of all mental illness begins by the age of 14. What do you think?
Yeah.
Would you agree? I would.
Well, I was actually just thinking about how World Mental Health Day doesn't necessarily mean mental illness. Like it is obviously a part of recovery, but also I feel like we live in a world where like we don't get enough mental health days, and so
Right.
that's the reason why many organizations give paid mental health days. So I think it's just a good day to take a look at. Are we taking care of ourselves? Are our kids taking care of themselves? Are we making sure that our kids, like it says, are our kids learning how to handle stress
Yeah.
in a way that makes them feel like they're achieving something rather than in a way that makes them feel beaten down or in a way that's like taking from their self-esteem? Are their experiences enriching them as people, or is it making them feel burdened and like they don't measure up? And so I think that that's my daughter's in second grade right now, and second grade is very demanding today as opposed to when I was a kid. It seems, they have a lot. Our little second graders have a lot of schoolwork to do, so it's like, I don't know. So with all that in mind, I think everybody needs to take care of their mental health, and so yeah.
Absolutely. Yeah, no, it's great. I couldn't agree with you more. I think there are more and more demands, not just on young people, but I think everybody. And
Yeah.
they talk about it in here again. This is the World Health Organization. We're on Mental Health Day 2018. Just talking about building mental resiliency from an early age can help prevent mental distress or mental illness in young adults and, of course, into adulthood. So, you when you were talking there, I made a note to myself. So I think we have, as an organization, we have Columbus Day off, right? That's a federal holiday, but maybe we should switch it. Maybe we should switch it to have World Mental Health Day off instead of Columbus Day. Yeah.
Yeah.
Yeah, we could do that.
Indigenous Peoples Day.
Well, yeah, and maybe it kind of got me thinking, and I know we're recording this live, but it's just like maybe that day, maybe the organization should do something, not just have the day off, but maybe we should do like a retreat or something, or I don't know, something, because it's one thing I think to talk about it, like we're talking about it, but to actually put it into policy, put it into practice, to actually do that part of it, I think is really important, right?
Yeah. I'm really lucky that I work for an agency that actually cares about my mental health and actually cares about my wellness, as opposed to an agency that perhaps says that they care about my mental health, but actually really just cares about the bottom line. So I'm lucky.
Oh,
I feel grateful.
So nice. Thank you, Katie. All right, so
I'm just a lump of sugar.
So we're gonna say goodbye to our Facebook Live viewers here. We're gonna we've given you about 8 or 9 minutes. This is what the podcasts look and sound like, and so we'll finish recording this and we'll get it posted up today to SoundCloud, and you get to listen to the whole thing there. But this was just a little teaser. We were trying something out, and so I'm going to sign off to our live viewers over here. Thank you so much for tuning in. Katie, saying goodbye to you there. Yep. So hopefully you will tune in and want to be a part of future ones. So thanks so much for tuning in live. Listeners, of course, you're staying on because we're we're going to be going quite a ways longer. We got a lot to talk about here. So, all right. So, World Health Day. All right. So, which what do you want to tackle next? Which one sparked your interest there?
Well, I guess let's talk about how Montana got an F on the national grading scale for helping mental illness. There's a criteria, or many criteria that they have for you to meet. So there's ample opportunities for states to get A's in this. However, we got zeros in a lot of the areas, and so quite frankly, I don't really understand a lot of this legal talk. Jim, he's going to take the wheel, and I'm just going to interject when it's appropriate.
Okay, fair enough. So this is, let's give a little background here. I think this came out a couple of weeks ago. It was definitely September. This came from the Treatment Advocacy Center, so that's treatmentadvocacycenter.org, grading the states, and it goes from A to F. States of Michigan and Wisconsin got A's. Woohoo! Arkansas, Louisiana, North Dakota, Vermont, Wyoming. I was surprised by the Wyoming one. They got A minuses. Indiana, Idaho, Mississippi, South Carolina, Washington got B pluses. Arizona, Missouri, Nevada, Ohio, Oregon got B's. Georgia, Illinois, Iowa, North Carolina, Virginia got B minuses. Anyway, it goes on down the line. We're way at the bottom, right? We're in the F. We're in the red category. Alabama, Connecticut, Delaware, right? District of Columbia, Maryland, Massachusetts, Montana, Pennsylvania, Rhode Island, and Tennessee all scored an F. I was kind of surprised that we got an F. Anyway, this was Grading the States, an analysis of U.S. psychiatric treatment laws, examines the laws that provide for involuntary treatment for psychiatric illness in each state. To do so, we asked a crucial question: does the state law allow an individual in need of involuntary evaluation or treatment to receive timely care for sufficient duration in a manner that enables and promotes long-term stabilization? I think it's pretty straightforward what they were measuring there, right?
Right. Yeah.
And so, when you go to this site, again, it's treatmentadvocacycenter.org, and then you just click on your state under the grades. And so when you bring up Montana, Katie's absolutely right. I mean, we did not score very well. Many of our categories score a 0, and what they're looking at is the Montana annotated code. So, for example, Category 1 says citizen access to court or emergency evaluation. Citizen access to court and emergency evaluation is worth 5 points. For Montana, the county attorney files the petition with the court on probable cause. There's no family involvement, and there's no agent or peer supporter or anyone else is involved. It's the county attorney's call, and so we score a 0. I'm guessing, Katie, in other states.
Honestly, I don't know how many of you actually have experienced a friend or family member or loved one going to the Providence Center here, and once you get admitted into the Providence Center, you have to wait for your attorney.
Mm-hmm.
And you can't even get out until your attorney comes, and then they decide whether or not you're going to go to the state hospital or jail, or a series of unpleasant places that only exacerbate your mental illness. But
right. Yeah, and so there's categories. Quality of emergency petition, we scored really well in. Emergency hold, we got a 0. Citizen access, I did that one. Quality of criteria for harm or violence to self or others. We actually scored a 10 out of 10. We actually did quite well in a couple of the categories, but we scored zeros. So anyway, when you total up our points in here, we didn't score very well. Part 1 we got a 25, part 2 we got a 34. It gives us a total score of 59, and so that's an F. We're not even close. I mean, we're not even in the middle of the pack. If you want to take a look at this, and so if you want to take a look at this, treatmentadvocacycenter.org, grading the states, you can click on any of the states. You can see what other states might have. Again, this came right out of the annotated code. And so, it's disappointing. Obviously, we're not measuring up very well compared to the other states. If we're at an F, we're not even close, and that's concerning. What can we do? That becomes the question.
Right. I was kind of actually thinking a few things. I mean, not about what do we do. One thing I was thinking was how much as peer support starts to grow and get more and more momentum, how much peer support work is going to change those things, and honestly, how much peer support in other states has an impact on their better grading. And the other thing I was thinking about was that I wonder how much in Montana it's always rural treatment, everything's rural in Montana, which isn't necessarily true, but there is a lot of rural area. Yeah. And so what I was thinking about is our population. Now, you would think that the fact that we have a low population would actually give us access to better services because people have more, our services aren't quite as tapped out. Or is it possible that because we have so few people, the problem isn't as bad here as it is in other places where the populations are high and mental illness is high per capita?
Sure.
So California also got a D-, and so I wonder, does it have to do with the size of the state? California obviously has way more mental illness than we do. I'm certain of it. I'm not sure, but I just wonder, why does Montana have an F? So
it's hard to say. I don't know if population is part of it. I mean, as I look at the bigger list, Idaho is a B+, Wyoming is an A-. Where's Alaska in there? Alaska's a D.
I think Alaska's a Dutch.
Yeah, a D, Yeah, I don't know. I mean, I think in this, it looks to me like, and again, we're not, either of us aren't attorneys, or experts in the annotated code, but, that's what they were looking at is the criteria. If you didn't have certain things like, for example, if your language is vague or ambiguous, you get a -3. I mean, we didn't get any minuses, but we certainly had a lot of zeros, which kept us from getting a much higher score. Like, for example, I'm looking at number 7, says quality of criteria for psychiatric deterioration. Well, you can get up to 10 points. We have 0. We don't have explicit criteria. And at the same time, since we must not have any language, right? So the language isn't vague or ambiguous, but we got a 0. I mean, a 0 is better than -3, I guess, but you'd hope to score at least a few points in each category. So, I don't know. I mean, again, I think Katie and I are just here to share this and report it, and hopefully you go look at it. And
I guess along those lines, what is it? So it says contains explicit criteria for 10 points, or the language is vague and ambiguous for -3. So doesn't it have to be one or the other?
Well, obviously, you would think, but I think it seems like if they couldn't check a box, then they just gave you 0. So if it was negative, it was vague, then I guess you get the -3. If it's explicit, that's what they were looking for, was a 10. If you don't have either one, then I guess you just get a 0, So Just seemed like we scored a
Yeah.
0 in a lot of categories. You know, as you look down there, I mean, there's a number of categories. We have a 0, 0, 0, 0. You know, so that really hurt us. I don't know. You know, maybe there's some work that could be done. Maybe Craig Fitch, attorney with the Board of Visitors, you know, at the state hospital, be interesting to have him on and see what he thinks, and maybe he could come on and be a guest, maybe on a future podcast. That'd be interesting to hear from him, an attorney. Yeah. All right. So again, treatmentadvocacycenter.org, grading the states. Montana scored an F. Not very good. If you want to go check that out, again, just sharing the information with you. So, all right. So, what's next there, Katie?
Certification.
All right, certification. So, this worthy of a sound effect there. Worthy of a sound effect, I think. National Certified Peer Support Specialist, right? Now, don't get this confused, Montana. Do not get this confused with our state certification, okay? So this is a project that Mental Health America National has been working on for a number of years. I went to a workshop Patrick Henry put on a number of years ago at I think I was in Memphis, the national conference, and he was talking about about putting this project together. So the whole idea is, behind it really is that if you're certified in your state, okay, so now Montana is one of these states, you would get certified, and then you would go and take this exam, okay? It would give you a national certification. This is moving us towards funding from private insurance. Right, so this is a really big deal. This is a game changer. This is just like, you know, Medicaid. We're trying to get peer support funded under Medicaid. That's a game changer. Private insurance, that's a bigger game changer. That means anybody could get peer support who has private insurance, right? Because right now, if you have private insurance, you know, Blue Cross Blue Shield or Pacific Source, they're not paying for peer support. So
Right.
imagine how many people, I mean, I don't know how many people Blue Cross insures in Montana, but I'm guessing it's significant, right? So, national certification, all you got to do is Google it, National Certified Peer Specialist, NCPS. It'll come right up, Mental Health America. It says advance your career. What are the requirements? Why? How do I get started? You know, that kind of thing. You need to be certified in your state, right? So those of us who are getting certified here in Montana, you're going to be eligible. You also need to have a minimum of 3,000 hours of supervised work or volunteer experience providing direct peer support. What's that come out to for a worker there, Katie? 3,000 hours?
I think it might be 3 years. I think.
3?
Wait, no. I think 2,000 hours is 1 full year full time.
My 40, 75 full-time hours, 75 weeks. 75 weeks, yeah. So you would then divide that by 12. Is that right? 75 weeks? No.
Yeah, I think it's a year and a half.
Year and a half. So there you go. So you need a year and a half certified working and, oh, hang on. Okay, so 1.5 years certified as a peer supporter. That's what we're looking at. Okay, that's really not that long, you know. That's really not that long. All right, so and you need a letter, one professional letter of recommendation, and one supervisory letter for recommendation also. So, all right, that's not too bad. I didn't see a cost on here. Did you see a cost listed?
$200 for the exam and $225 for the application.
Oh, okay. So not cheap, that's for sure. There's some links here. You can click on certification guidelines and requirements, and self-assessment checklist, test preparation, those kinds of things. I think this is the future. I really do. I think that, right? I mean, if you think about it right now, when we talk about peer support in Montana, you're talking about providing peer support. It's being funded through grants, through the state or federal or foundations, that kind of thing, which gives you some freedom. And, we're probably going to get funding through Medicaid here in the next year or two. And, that means a person has to be on Medicaid to receive the peer support. And that kind of changes things, because what about the other folks? That's what I think about, is what about the rest of the community? There's lots of working people. We just talked about World Mental Health Day. There's lots of working people who have insurance, right, who could benefit from peer support. And so, I think as I look further down the road, 2 years, 3 years, 4 years, that kind of thing, I think that's the future. I think you're going to see peer support's going to be, for people who, are having a tough time emotionally, whatever that they're dealing with, being able to offer them a peer supporter and not have to be, oh, do you qualify kind of thing, right? It's like, well, we have programs for people who have insurance. There's programs for people who don't have insurance. Maybe you're on Medicaid, so that everybody can get it. Why can we only offer it to select people?
Yeah, and also, I think we're coming away from, it's like we've talked about before, like when somebody goes into a crisis house, are they really in crisis, or could they just use a peer supporter?
Right.
Are they really just lonely?
Right.
Do they not have the tools that, people who have been in recovery a little longer, I was thinking really hard recently about, what are the tools that I use that prevent me from going into crisis? And it's people.
Yeah.
People, that's my tools that I use to get out of crisis. When I'm about to freak out, I call a friend and they help me not do that, and they help me get my head in order. And so, how much could peer support save nationally? If a peer supporter could just go to someone's house instead of sending them to a crisis house, which Medicaid pays for.
Exactly.
Right?
Well, the state's paying the tab. If you end up in the BHU and you don't have private insurance, the state's paying the tab. So, exactly. And that's what we're trying to do, like in Butte, right? Is, we have peer supporters there that can work in the community. They can work with anybody. It's not about whether you can pay or not, whether you get the help. They're just there to help you if you need it. So I like that much better, right? It eliminates some of those barriers that exist that, prevent people from getting all the help that they could use, right?
Right. And it's sad that, once you go to jail, you get all the services that you need for free. The taxpayers are paying for it. It's not a decision anymore. Like, nobody gets to decide. But if we could, nip that in the bud before it gets to that point, if Medicaid can pay for services that are preventative rather than, when it's too late.
Absolutely. Right. Absolutely. I think that's the name of the game, is you're spending way more money when someone's incarcerated or somebody's in the state hospital, or, even if they're going to MCDC, the Chemical Dependency Center, those are high-end, high-cost services. And so everyone knows, World Health Organization talks about this with everything, all diseases and illnesses, prevention, prevention, prevention. And that's really where I see peer support, getting out in front of it and being preventative. Yeah, right.
Yeah.
All right. So as we've got about 8 minutes left here, I want to leave time to talk about all these cool trainings that we have coming up, right? So let's transition into events, and let's talk about what we've got coming up here. So, Katie, tell us.
Do you want to start with the clinical supervision?
Sure, go ahead. Just roll them out because we got a bunch of stuff going on, right?
Okay, so all of you people who need a clinical supervisor or people who are interested in becoming a clinical supervisor, we have a clinical supervision training coming up in Helena on November 1st.
Yep.
And that's at the, where is it, Jim?
Oh, trivia question here. That one is at Delta by Marriott, right? Isn't that where we're at?
Oh, yeah.
Former
Yeah.
Colonial Inn, used to be the Colonial Inn. And so if you're from the area, you probably know it as the Colonial Inn, but now it's Delta by Marriott. Got a nice facelift, I will say. I was there the other day, and that hotel it's looking really good. Got a nice new look to it. Yeah.
Yeah, I'm from Helena, so I keep forgetting the hotel because it's named Delta.
Yeah.
And I'm from Helena, so I don't even know the Colonial Inn. I'm like, Delta?
Yeah.
What?
Yeah, I don't know if the road, even the road's named Colonial Drive. I was wondering if they would change the name of the road. Like, I don't know, like.
Yeah, and then it says airport at the end. Delta Suites Airport? I'm like, that doesn't make any sense, but that's where it is.
Okay.
So, their trainings are, we've got trauma-informed peer support in November. So, we've got 3 of them. There's one in Helena on November 13th, and that is also at the Colonial Inn or the Delta Airport, the Delta Suites Airport. Then we've got another one on the 15th of November, and that's in Missoula, and that's at the Holiday Inn downtown. And then we have another one, and this is going to be, we're kind of trying to pave the way here and get, move these services north anyway. So we're doing one in Pablo, Montana. It's actually at SKC, the Salish Kootenai College. And, so we're trying to get some people from Kalispell, people from the Flathead Reservation, try to open things up in that direction. So, yeah.
That's fantastic.
I look forward to seeing you guys there. And then also, we have navigating complex relationships. So basically, that's boundaries and ethics workshop, but it's kind of got a different twist on it. It just has a different twist, but it also is more rooted in peer support. And so it's not, we're trying to move away from the boundaries and ethics terms that are basically coined by the clinical aspect of treating mental illness and substance use disorder. And we're kind of trying to move towards using our own language, which is navigating complex relationships. So the first training is in Helena on October 23rd at Delta Airport Suites or the Colonial Inn, and the other one is on October 25th in Missoula at the Holiday Inn downtown. And so I gave a little tester of this workshop at our recovery conference, and people loved it. And so basically my promise was I was going to beef it up a little bit. I was going to add a few topics. There's going to be role plays. I'm pretty excited about it. So a lot of it has to do with the supporters taking care of themselves. And so I love you guys. I want you guys to be there. Exactly.
If you're listening, you're a peer supporter, you might really want to think about attending really both of these trainings. They're both going to get you CEUs, number one, but really, it's about that knowledge base, expanding, your knowledge about peer support, right? Don't fall into that trap of, oh, I'm a peer supporter, I got my certification, I don't need anything else now, I'm good. I know everything there is to know. You need to keep educating yourself and keep learning, and these are 2 wonderful trainings. So hopefully you will attend. You can go on our Facebook page, has all the details, and then they email you, Katie, right, if they want to sign up. Yeah, please.
Yeah, and then I'll get you guys signed right up. It's free of cost. All the trainings are free. We're really lucky to be able to do that and give that for free at this time. And, I was telling Jim yesterday morning, I think it was, every time I read or take a trauma-informed care, I've had to do a lot of reading about this training. And every time I read more about trauma-informed care, the more I learn about myself. And it makes me excited.
Yeah.
It makes me engaged. And so that's like kind of the spice of recovery, is being able to engage in our lives and be a part of the present moment. And so, every time I learn about trauma-informed care, I learn about myself.
Yeah.
And so
good point.
It's exciting.
Yeah, absolutely. Good point. So we've got about 2 minutes left here as we're starting to wind down. And Peer Support 101. So Helena is filled. We're going to be doing that next week. So that one you can't get in on. But the next one is in Missoula, and that is the week of December 3rd. That training's about half full already. So we still got about a dozen slots left. So if you want to sign up. And then after the first of the year, we'll be in the Billings area. And so we don't have those dates quite set up just yet. We're also looking at another clinical supervision training in the western part of Montana. So look for those upcoming things. And again, go to our Facebook page. That one has all the support groups and trainings and presentations, all the stuff that we're doing, and tells you how to sign up and get involved. So, yeah. And
sponsor a podcast, $25, and we'll peddle your shit.
Exactly, right. So you got something you want to sell, you got something, it's got to be recovery related, of course. This isn't eBay over here. But if you want to sponsor a podcast, $25, sponsor one of these podcasts, get your information out there. Hope you get in touch with us. So you can email Katie at mtpeernetwork.org or myself, Jim, at mtpeernetwork.org. We have about 30 seconds, Katie. What do you got?
Nothing. I guess I just love you guys. Thank you so much for listening. Missoula represent at the Peer Support 101.
Absolutely.
That's it.
Absolutely. All right. So thanks everybody for tuning in. Another great podcast, and tell your friends about this stuff and share it with other people, through Facebook and SoundCloud. Go to our website. We're putting lots of good information out there, and have a happy and safe Halloween in case you don't hear from us before then. So Halloween's coming. That's always a fun kind of holiday. So take care, and thank you so much for tuning in. And that's my sound effect. That's right. Okay. That's all I got there. The door slamming. So as we leave. So all right. Thanks everybody.
Recovery works and recovery is possible.
Recovery works and recovery is possible.
Recovery works, recovery is possible.
Recovery is possible.
Recovery works and recovery is possible.
Recovery works
and recovery is possible.
Recovery works and recovery is possible.
Recovery is possible.
Okay.